Hi, welcome to Tuesday Talk with a Therapist. Myself, Felicia Cameron. I'm a licensed clinical social worker for the great hospitality state of Mississippi. I am the owner and founder of Lending a Hand, where I provide therapy service for people who are dealing with anxiety and depression in the state of Mississippi. Look, today's Tuesday Talk, we're going to talk about something that I've been seeing a lot in the media, talking about COVID-19 vaccine, and weekly tests. And I know there's been a lot of issues in the media talk about now there's a requirement or there's talk about being a requirement that on certain jobs that you have to get the vaccine or you be subject to weekly tests. So today's topic is on Tuesday Talk with a Therapist. What should I do? Should I get the COVID-19 vaccine or should I be subject to weekly tests on my job? And I chose the topic because this topic is causing people to deal with anxiety. It's causing them to deal with now extra stress on top of the other stress that they're dealing with to now to have to decide what decisions I should do. Of course, with this Tuesday Talk, I'm not telling you which decisions to make, but we are going to use a technique that I kind of use in one of my counseling sessions with my clients. It's called a cost benefit analysis, or it's basically what I call is a pros and cons of your decision. Take a look. So there's two columns. Let's see, can you get a good view? What are the advantages of taking the vaccine as pros, and what is the advantage of weekly tests on my job? Cons. What's the disadvantage of taking the vaccine? And cons, the disadvantage of weekly tests. So basically, I would encourage you for you to take out a sheet of paper. If you're a person in this situation where you at a job, where you got to now decide, should I take the vaccine because of my job is now saying I have to take the vaccine or I'll be subject to weekly testing. So I would encourage you to take a sheet of paper. What is the advantage for you, particularly you? Don't base it on anyone else's situation, but what is the advantage of you taking the vaccine? By you doing your own research on the vaccine and regarding your health. What is the advantages? What is the pros for you taking the vaccine? What are the cons? What is the cons for you taking the vaccine? What are the advantages of you doing weekly tests on your job? Because if you don't take the vaccine on your job, you are subject to either weekly testing, COVID-19 testing on your job. So what are the advantages? What is the pros, the good part? Again, weekly tests on your job. And then also, what is the disadvantages of you getting weekly tests on your job? And after you sit down and jot down some things, the advantages and the disadvantages of the vaccine or weekly testing, then making the best decision for you and deciding in this time in your life with the current job that you're in, what do you want to do? Not what the media tell you to do, not what family and friends tell you to do. Well, what is the best decision for you? Is that decision for you to take the vaccine? Or is that decision for you to get weekly testing? And then there's a third option. Because we have on the table, either you get the vaccine or you get weekly testing. But there is a third option. And you said, Felicia, what is that third option? I want you to really think and process. The third option is, do I decide if I'm not sure, should I get the vaccine or weekly tests? Do I decide now do I want to continue to work at this job? Do I decide that it's time for me to make some decision and start my own or try different career opportunities? This Tuesday Talk is not trying to force anybody or encourage anybody to get the vaccine or not to get the vaccine. Yes, I do see a lot of people encouraging people to get the vaccine, but my talk to you is those who's dealing with stress and anxiety about now with the decision on their job, or now they got to be making the major decision on whether or not to get the vaccine or not, or be subject to weekly tests on their job. And with the option where there's also mentioned that you could lose your job if you don't subject to either one. So now you force like that you don't have options. But I want you to think about it and write it on paper and look at it and make the best decision for you, because you do have options. And make sure you do your due diligence and research about the vaccine, the advantages, disadvantages, the advantages of weekly testing, disadvantage of weekly testing. And you make that decision for you. And you stick by your decision. Okay? Whether you decide to get the vaccine or not. This Tuesday Talk is really to help you to use a technique where you do the pros and cons, or a cost benefit analysis. What is the pros and cons, advantages and disadvantages, or decision what I should do? So you can be comfortable in that you made the decision for you. Okay? Not administration, not politics, not family or friends, not job, but you make the best decision for you. Yes, I do understand that we are in the midst of a pandemic. And I understand that many people feel strongly about the vaccine, and many people feel strongly or not about the vaccine. That's not what I'm here today for. This tool's technique is to help those who's dealing with a situation, as well as they dealing with anxiety, that now they have to come to the conclusion on what should I do now in this particular situation regarding my job. Should I get the vaccine, or should I be subject to weekly tests? And a third option, is it time for me to move on to a different career if I don't feel either way? It's an option. So this Tuesday Talk is a little bit different. I want you to use that technique to, you put it on paper and you make the best decisions for you. Continue to do your research and talking to people and doing your research about either decision that you decide to make. And look, if you need to talk to a therapist to help you out, to help provide you with the tools and techniques for help you with life, give me a call. If not me, find another therapist. But you don't have to make life decisions on your own. And I'm not saying I'm here to help you make life decisions. Therapists are here to help you, talk you through, provide you the tools and techniques, the therapy style, so you can make the best decision for you. Because guess what? You have to live your life for you, not for anyone else. Stay tuned for next Tuesday Talk with a Therapist. I look forward to seeing you again. Thank you.